So we're almost at the end of the class. And so these are the complications that is related with preterm babies. Okay, so preterm babies, most important complication that you have to know. So most important complication that we have to know, if you have to review, you have to know about hypothermia, hypoglycemia, and infection. Okay, so these three are very important complications faced by a newborn. So hypothermia ko management case, we make a warm chain in the delivery room and advocate early kangaroo mother care. Hypoglycemia is prevented by proper feeding practice. Infection is prevented by hand washing and decreasing unnecessary intervention. Hyaline membrane disease, we can be treated by giving surfactant. Intraventricular bleeds can be treated by minimal handling and careful handling of babies. Feeding difficulty, necrotizing enterocolitis, slow feeding, ekaichoti baby le दूध खान सक्यो भन्दैमा full feed गर्दा start गर्ने हैन. We start with small feeds, 2 ml दिनको 2 चोटी मात्र दिने, त्यसपछि we gradually increase 1 ml per day, 1 ml per day बाट increase गरेर, and in the span of almost 1 to 2 weeks then we go to the full feed. Okay, this is how we prevent necrotizing enterocolitis, by starting tropic feeds, slow and steady feeding start गर्ने, एकैचोटी बढी feed नदिने. Apnea prematurity occurs because of immature brain, immature respiratory center in the medulla oblongata. Okay, this can be treated by giving caffeine citrate or starting on CPAP. Now, PDA, we'll talk about this in our cardiovascular class. PDA is basically a patent ductus arteriosus. This is open, persistently open in case of preterm babies. Okay, so what happens is baby will come with cardiac failure, congestive cardiac failure ko feature lera auncha. And this is usually prevented by preterm babies. There is spontaneous closure. If you put the child on oxygen, त्यसले गर्दा vasoconstriction गरेर close हुन सक्छ. If not, it is usually closed by giving acetaminophen or ibuprofen. Okay, so PDA ko detail we will talk about in our cardiovascular chapter. Now, anemia can be prevented by unnecessary pricking of the child, unnecessary blood draw nagarne, and we start anemia, start iron early in life. Okay, retinopathy of prematurity is prevented by judicious use of oxygen. We can prevent this by not using oxygen unnecessarily. And if ROP develop bhayihalyo bhane, we can treat it by giving laser therapy or anti-VEGF injection. Okay, so these are some different management of preterm babies: temperature control, infection control, hypoglycemia, anemia, prematurity, IVH, ROP, sensorineural hearing loss, necrotizing enterocolitis or NEC, feeding bio, prolonged hospital stay, problem huna sakne preterm babies. Okay, so when can we discharge the preterm babies? Usually, the babies can be discharged only when there is a consistent weight gain for a few days before discharge. Usually, we do not discharge the baby before the baby has reached 1.5 kg, 1500 gram na we do not discharge. Okay, or 1500 to 1800 gram discharge garne. Or if the parents want to take the baby home, at least the baby should be gaining weight for 3 days, 3 consecutive days before discharge. 15 to 20 gram per day, 3 दिन लगातार weight gain भइसकेपछि मात्र we can discharge the baby. Number 1. Number 2, the baby should be tolerating feeds. Okay, खानै सकेको छैन, मुखबाट खायो भने vomit गरिरहेछ भने we cannot discharge the baby. So the baby should be tolerating feeds. Or if we can start breastfeeding, that is best. Breastfeeding start गरिसकेपछि मात्र ideally the baby should be discharged. Otherwise, at home, the mother won't be able to properly feed the baby and they will land up in emergency in sepsis and shock. And they should not be discharged with IV medication. All the IV medication should be off before discharging. And the parent should be confident and compliant enough to take care of a newborn. If the new mother is not confident enough to take care of a preterm baby, she should be counseled again and again. Then when she is confident enough that she can take care of a baby at home, then only the baby is discharged. Okay, and the mother should be able to administer proper KMC and temperature monitoring at home. The baby should have at least received BCG vaccination before discharge, and the baby should have completed a screening test for ROP and hearing assessment before discharge, and the baby should be given all the nutritional supplement and should be continued even after discharge. Okay, so we should have started vitamin B complex with zinc. We should have started on vitamin D, calcium, iron. Usually we start after 1 or 2 months. So iron can be started at follow, but other, it should be started before discharge. And after discharge, until the child becomes 37 weeks, completed gestational week, Navasamma, until the child has developed a certain weight, they should be asked for regular follow-up every 3 to 7 days. Okay, so these are the criteria of discharge, and they should be asked to follow up every 3 to 7 days before they reach a certain 2.5 kg Navasamma, 37 completed weeks Navasamma, they should be on follow-up. So consistent weight gain for a few days before discharge, tolerating feed, completion of IV medication, parent confident enough to take care of a baby, can provide proper KMC, has started an immunization, has already had screening tests for ROP, and completed regular nutrition supplements, then we can discharge the baby. Okay, so this is all about preterm deliveries. Are there any questions? Any questions?
Sorry, ma'am.
Sorry. No questions? Okay, if there are no questions, I'm going to end this. Next class, I think we will be starting on cardiovascular system. Okay?
Ma'am.
Okay.
Thank you, ma'am.
Okay.
Thank you, ma'am.